this. Do you take a look in the mirror? When you look at your eyes, do you see extra skin drooping or hanging over? Some people call it a hood. Did you know that there is something that you can do about it? But you want to make sure you are with an expert surgeon. Not any surgeon, an oculofacial plastic surgeon. Did I get that right?
That's right.
Okay.
That is right.
I want you to meet Dr. Zachary Purvis with Visage Aesthetics and Plastic Surgery.
Nice.
Thank you for inviting us here today.
Of course, thank you for coming.
Well, first of all, you have an amazing office here.
Thank
It's
you so
beautiful.
much. A lot of people worked hard on this place.
Oh, well, it certainly shows it.
Thank
I
you.
want to talk a little bit about the specialty that you do. There's not a lot of doctors out there that do, it's I want to make sure I get this right, oculofacial plastic surgery.
That's right, oculofacial. So oculo because we train first as ophthalmologists. We spend 4 years training in ophthalmology, where we work on the entirety of the eye and then focusing on eyelid surgery, upper and lower eyelid surgery. From there, we go to facial surgery. So 2 years of facial plastic surgery training, where we move from the forehead and eyelids down to the mid-face, lower face, and neck.
Okay, so Dr. Purvis, tell me the difference between maybe going to a plastic surgeon versus going to you.
Right, I think that's an important distinction. So general plastic surgeons work on the total body. So that's from the face to neck, the abdomen, chest, the whole body. Whereas oculofacial plastic surgeons restrict our practice to the face and neck. So in general, an average plastic surgeon in this Phoenix Scottsdale area will do somewhere between 50 and 100 eyelid surgeries per year, whereas oculofacial surgeons do between 1,000 and 1,500 eyelid surgeries a year.
Okay, big difference.
Right.
Okay, let's talk about who's a good candidate. You know, we're taking a look at some before and after pictures, and you know, some of it, I mean, it can get pretty bad, you know, the skin, and almost disruptive to our lifestyle.
Sure. The term candidate ranges from a small bit of trouble putting makeup on because the skin doesn't fold the way that it used to, all the way to restricting peripheral vision because of how severe it is. So when you have a consultation with us, we bring you in, we'll evaluate a few measurements and visual fields to determine whether you qualify for insurance. If you do, we're happy to run the procedure through your insurance. Should you not qualify for insurance but still are interested in surgery, we're more than happy to do that as well.
Okay, and let's talk about the difference between men and women. And you know, a lot of men have the same problem, but you know, this whole procedure, you know, kind of intimidates them a little bit. What would you tell them?
Sure. So a lot of men are rightfully so concerned about having facial surgery, with concerns of looking different or looking overdone. Many men come in because their wives drag them in, because they're concerned with the way that they look or their vision. And I would say that it is important to understand that there are big differences between the male and female anatomy. Doing surgery on a man differs entirely from doing surgery on a woman. You need to retain certain qualities of the male eyelid and eyebrow in order to retain a masculine appearance. And in general, I try to make men look like they didn't have surgery.
And there is exactly why you should go to an expert.
Yeah, exactly.
All right, so that's why the consultation is super important, you feel, right?
Exactly.
Okay, and then just very quickly, is there a lot of downtime involved?
So in general, I tell people that you are going to look like you lost a fight for the first 2 or 3 days. By 1 week, most people can do almost anything that they want to do, and by 2 weeks, no one should be able to tell they had surgery.
No kidding. Yeah. Wow. And what are people saying when they see themselves for the first time after they've completely healed?
So in general, people are really surprised at how easy it was to go through this surgery and how happy they are with the outcome.
Absolutely, right? Oh, I look 20 years younger.
Right.
Thanks, Doc. All right. I really appreciate you having us over here. And also, I have a very special offer as well. Yeah, that's right. Visage Aesthetics and Plastic Surgery, they are offering up 50% off a cosmetic consultation or laser treatments. Buy 2, get 1 free, or $20 off their Skin Better skincare purchase of $100 or more. That offer is good through May 31st of this year. Here's where they're located. Visage Aesthetics and Plastic Surgery, 8763 East Bell Road at Suite 106 in Scottsdale. Call this number to set up your appointment, 602-842-4795, or visit visageplastics.com.